Good day everyone, my name is Mary Grace Pasigado, the project leader. Today I will present to you the web-based health immunization management system, Barangay Estefania.HealthCenter. In Chapter 1, in our background of the study, the immunization management system for newborn babies is a global health and development success story for saving millions of lives every year. Immunization is a reduced risk of getting a disease by working with your body's natural defenses to build protection. While COVID-19 is disrupting our daily lives, to try to get your child vaccinated where services are available. It is important that children and babies keep their vaccinations up to date because they protect them from serious disease. It means that when your children can return to interacting with another children, they have protection from some other diseases too, according to UNICEF. The Barangay Estefania health workers and staff and doctors has the ability to access information, facilitate communication, and improve efficiency in nearly all aspects of life. Similarly, the use of technology to directly impact on the health of population as well as to provide access to important public health information holds great promise that is emerging at the forefront of medical care and public health industry according to CF Health. Health workers at the health center are used paper-based system to register the children who have been vaccinated and the vaccines and other resources used during the process. They report this data to doctors through monthly monitoring and aggregate reports. Manager monitor and evaluate key performance indicators and each jury can take corrective action when needed. In terms of immunization, the Barangay Estefania provides a new system which is web-based health immunization management system, Barangay Estefania Health Center. Through this system, the residents of Barangay Estefania Health and Barangay health workers are easygoing process gather the data of infant monitored over the internet. When COVID-19 strikes us, many parents are worried about their children's immunization because of pandemic. Teenagers under the age of 0 to 17 are not permitted to leave the house because their health is risky. Our statement of the objectives this study aims to develop. First, web-based health immunization management system in Barangay Estefania Health Center with the following functionalities. Admin can register parent and children data and the system provide notification through email, provide comprehensive interfaces for easy access, provide the user medium interfaces such as PC, smartphone, and tablet, create view list of user registered, scheduling and monitoring immunization status, and lastly provide immunization reports. Second, to evaluate using computer system usability questionnaire or CSUQ in terms of its system usefulness, information quality, interface quality, and overall satisfaction rating. Our framework of the study. The coverage of the study is to provide the basic structure of the web-based health immunization management system in Barangay Estefania Health Center. This conceptual shows the workflow of the system. In input process, we input the parents' data, the children's data, and staff data. And the process, which include manage parent and children's data, immunization scheduling, and statistical report that our output is the system web-based health immunization management system, Barangay Estefania Health Center. The scope and delimitation of the study. First, we determine the scope. The scope, the admin can register parents and child data and the system provide notification through email. The system provide comprehensive interfaces for easy access and also provide a user medium interfaces such as PC, smartphones, and tablets. The system created and view list of user registered. The staff can schedule the immunization and monitor the report. Our delimitation and limitation of the system is the system limits the system procedure. The system can access only who already registered. The system limits only 50 newborn to be vaccinated every schedule due to the pandemic. The system cannot accessible without internet connection. The significance of the study, which have the following. The Barangay Estefania. This system will help to the Barangay Estefania to improve online immunization for the parents and infant. This study will enhance the process of scheduling the immunization system of Barangay Estefania. Second, the health workers. This study will assist the BHW or the barangay health workers in gathering information on infant in more efficient manner. This system will help them to reducing their paperwork. The nurse. This study will help to the nurse to summarize the reports from the barangay health workers. They don't need to record all the data manually. Nurses play an important role in immunization counseling and promotion. This involves giving shots as a part of the pediatric immunization program. For the parents, this study will help the parents to easily monitor their child immunization schedule and up-to-date their vaccine. For the researcher will gather data that will aid the system effectiveness. In this investigation, it is an opportunity for the researcher to apply what they have learned. In operational definition of terms, conceptually tells what the concept means, what your constructs are explaining, how they are related to other constructs, according to Flores Utilia Obimer in 2018. Operationally, a description of something in terms of operation, procedures, action, or process by which it could be observed and measured. In barangay health workers, conceptually, this is defined a person who has undergone training programs under any accredited government and non-government organization and who voluntarily renders primarily health care service in the community after having been accredited to function as such by the local health board in accordance with the guidelines promulgated by the DOH. According to DOH. According to Ronel Daguhoy, the operationally barangay health workers assist children in immunization. If they do not come, we follow up with them. For the researchers, conceptually, the researchers are employed in almost every industry to recognize pattern, locate, analyze, and interpret the data. They may work in academia, science, medicine, finance, and other sectors. With varying duties depending on their research goal, the researcher used the internet, books, published articles, or survey and interviews to gather the data according to better team. Operationally, researcher explained the study's purpose of immunization management system and conducted the effectiveness of the system according to J. Garcia Diaz. The infant. Conceptually, according to Webster, all defines an infant as a child in the first stage of life but does not keep any age specific and describe as baby as extremely young child. The World Health Organization defines a newborn infant or neonate as a child that's under 28 days old. Operationally, infant vaccine health record to the documenting vaccination received by the children according to D. W. Brown. Parents. Conceptually refers to a father or mother, one who has generated or produced correlated to child offspring descendants according to current person. Operationally, parents provide basic immunization to infant according to Layuda Ikrama. The doctors. Conceptually refers well-trained and licensed medical professional according to Mary Beth Burns. Operationally, doctors are performed the procedure and have control in vaccination according to S. Caprilli. In Barangay Health Center, conceptually, it refers to a barangay health station or barangay health center is a basic first-hand healthcare facility. In the grassroots level, it can cater vital health services to the community. It has numerous purposes, serving different populations, from immunization, prenatal care, monitoring, or morbidity, So serving as a part of the referral system, the Barangay Health Center is an important part of establishing healthy community, according to Kathleen Alexandra S. Balsini and Joe Albunen. Operationally, according to S. Basu, health clinic was operationally defined as the administration of the scheduled vaccination after receiving vaccination.
I am April Joy D. Tandog, the documenter. I will discuss the Chapter 2 review of related literature. Local studies. DOH launches vaccine program against measles, polio, and rubella. Center for Health Development in Bicol and Mimaropa ramping up. As the global COVID-19 pandemic continues, the Department of Health is encouraging the public to join immunization program that would defend its children from vaccine-preventable diseases such as measles, polio, and rubella. The first to ramp up are the DOH Centers for Health Development in the Bicol and Mimaropa regions. The need to boost immunization in Bicol comes from the fact that 35% of children in the region who are eligible still do not have vaccinations. In 2018, only 104,853,000 children have been immunized. With the recent disruption of immunization service due to the COVID-19 pandemic, the number of children who are not immunized may increase, which may result in the spread of diseases, according to Relief Web 2020. UNICEF urges parents to get children immunized. Manila, in February 8, 2019, UNICEF is alarmed at the recent reports of various occurrences of measles outbreak across the Philippines. Reported incidents of death and illnesses in children from the vaccine-preventable diseases is unacceptable. Recent report from the DOH and the World Health Organization show there are more than 20,000 reported measles cases in the country as of December 2018, a 500% increase compared to last year. UNICEF is fully committed in supporting the Philippine government to fight measles by ensuring the vaccines that are available. We also provide technical assistance to improve coverage of routine immunization and supplemental immunization activities and improve public awareness on measles vaccination, according to UNICEF.org 2019. Timeliness of childhood vaccination in the Philippines. Monitoring of immunization program performance has typically been assessed through measurements of vaccine coverage, the proportion of individuals who have received a vaccine by a benchmark age, regardless of the timing of administration. These do not take into the account the timeliness, which detects adherence to vaccination schedules. Delay immunization have potentially serious consequences. First, children with delayed vaccination will be unprotected from the vaccine-preventable diseases at a time when they are most at risk. Second, substantial delays may contribute to diminished herd immunity or the indirect protection received by the unimmunized population when a large proportion is immunized. Third, previous studies have demonstrated the association of delayed vaccination with increased risk of pertussis, measles, and hemophilia influenza type B infectious and outbreaks. Fourth, delays increase the risk of failing to achieve full immunization of child. Thus, adherence to immunization schedules or timeliness of vaccination is also an important indicator of a successful national immunization program aside from vaccine coverage. In the Philippines, only one published study examined the timeliness of immunization. The Philippine EPI had also been monitoring programs implementation using vaccine coverage rates. In this study, we explored the timeliness of infant immunization and assessed factors that may be associated with delayed vaccination using immunization records review and caregiver interviews, according to Raginden, T.F., Morales Dizon, M. L.W.J. et al. 2021. In foreign studies, we have analysis on application of the surveillance and management system of children immunization in Jinyu district of Chengdu City in 2000. To investigate and the application, the parents' acceptance, and the contribution to our EPI work of SMSCI, the surveillance and management system of children immunization. Methods: interviewing the operators of SMSCI in each vaccination spots and some parents analyzing the relevant EPI information. Result by the chi-square test, the time spent on finishing a vaccination before SMSCI was established is not different from the time after SMSCI was established. While the time spent on finishing the statistic forms indifferent, more than 90% parents think the price of SMSCI card reasonable. Conclusion: the establishment of SMSCI has improved the EPI management level and working efficiency in each vaccination spot. The system was convenient for children. Immunization and its charge could be accepted by most children parents. It increased the vaccination spots and epidemic prevention stations' income and compensated the lacking of EPI expenditure to some degree, according to Tong, Rong, H. Shumei, and L. 2022. China National Immunization Program Information Management System. On the basis of summarizing the status of China, not include Hong Kong Special Administrative Region, Macau Special Administrative Region, and Taiwan Sheng. Immunization Program Information Management System National System construction has been put forward. The construction of national system relies on the State Medical Reform Information Project. During the period of the 12-5-year plan, business logic high degree of unity, the physical distribution of national immunization program, appropriate data center, and provincial municipal center immunization data points will be built. In order to collect the case report of children immunization and the information of AEFI and to achieve vaccination of migrant children of information exchange, a nationwide immunization information management system and adverse events following immunization information system was established. Vaccine preventable diseases surveillance, cold chain equipment, syringes, and vaccine management system to monitor vaccination information monitoring network system will be improved. System will follow the master plan to standard uniform, resource sharing, classification of construction, the principle of gradual implementation step by step. In order to ensure the information management system running normally, long-term financial investment mechanism and improved funding mechanism should be established according to Cao L. and Yuan et al. 2010. Immunization Program Information Management System and Weifang. The monitoring quality of routine immunization coverage rates of the immunization program information management system was analyzed during 2008 to 2012. The uploaded rate of BCG, HBV, OPV, DPT, and MV was 93.87%, 96.10%, 100%, and 100%. The reported immunization coverage rate was from 95.4% to 99.64%. Estimated coverage rate of routine immunization was from 96.49% to 115.80%. The reported immunization coverage rate was reliability in 4 countries of Weifang and was susceptibility in 4 countries was reliability and susceptibility in 1 country. Susceptibility and not reliability in 3 countries. Of the 16 R-value, reliability susceptibility accounted for 81.25% and 18.75% respectively. The immunization program information management system collect vaccination coverage rate with the high credibility that can use to reliable way to another access to the report of routine immunization coverage rates according to Wang, S. Wang Y, and Wang, 2012. The Immunization Program Information Management System collect vaccination coverage rates with high credibility that can be used as a reliable way to another access to the report of routine immunization coverage rates. Related system. The overall coverage of this study provides a comparison table of the related system of web-based health immunization management system, Barangay Estefania.HealthCenter, based on its local and foreign related studies. The comparison table provided below shows the following features of the system that is being compared to its related system based on the local and foreign related studies. Table 1 Comparison Table. We have the system features: infant record accessible online, parent-infant registration, clinical decision support, role-based user access, email notification of account, details immunization schedule. Synthesis. The coverage of this study provides a summary overview of the related studies and literature of the web-based health immunization management system, Barangay Estefania.HealthCenter. The local and foreign related studies that have been discussed are all related to the proposed system that has been analyzed and evaluated based on the related system, which are a basis for the comparison table. The local studies are studies or investigations already completed in the local country to which the present study is related to web-based health immunization management system, Barangay Estefania.HealthCenter. The local study of our first DOH launches vaccine program against measles, polio, and rubella. Center for Health Development in Bicol, Memorapa ramping up. Second, timeliness of childhood vaccination in the Philippines. And the third, UNICEF urges parents to get children immunized. The foreign studies concern the comprehensive research of literature of other countries. The foreign studies of the system are first analyzed on the application of the surveillance and the management system of children's immunization in Jinyu District of Chengdu City in 2000. Second, China National Immunization Program Information Management System, and the third Immunization Program Information Management System in Weifang. The comparison table provided in the related system is a tool that is used in order to identify and compare the different features of the system that needs to be applied and developed. The result of the study has concluded that the related system had different features that are needed to be applied to the system in order to be accurate, which is expected to have.
Chapter 3. Planning phase. In planning phase, the proponent established a plan to make the web-based health immunization management system more accessible during this pandemic. And the reliable data was straightforward to the record. The information was gathered by the proponent in order to determine the scope, limitations, and main objective of the system. We also interviewed the BHW. It is also necessary to obtain permission for the said system to be implemented. Analysis phase. To determine system needs and comply with features and functions to be added to the new system, the proponent analyzed the system is delving new system for the institution's existing systems and did a comparison of their associated systems after gathering the data. Development phase. The system is constructed in this step by the programmer, who follows precise coding requirements for the web-based health immunization management system. The proponents have no time to create the actual system after considering all of the major plans and needs from the previous phases. An actual prototype is constructed based on the requirements acquired and analysis performed during the system development. The prototype system is currently completely operational and functional. Testing phase. As part of this phase, the developer will collaborate with the proponents and the user to assess how the system performs in terms of its requirements, efficiency, effectiveness, and utility to the user. The system is truly tested and any characteristics that need to be enhanced are identified and recommendations for system modifications are made. Implementation phase. The system has previously been designed and tested. It is presently operational at this phase. It will be put to the test at Barangay Estefania.HealthCenter to discover if the productive and efficient to visit the website. Due to the fact that the system will be web-based, a duplicate test will be required to verify that the system efficiency is tested. The system will be tested for correctness with the participations of parents who will register in the proposed system. They will be able to determine whether or not they meet the project goals. Once the project proponents has been approved based on user feedback, a modification or change is feasible during this phase. Maintenance phase. The proponent employ backupping to update, repair, and fix the software it is break during the maintenance period. Through the detection of the error, it can aid our system. The maintenance phase may contain faults or problems that require corrections during additional software testing. During the maintenance period, there is also a monitoring of the software performance.
Chapter 4. The presentation, analysis, and the presentation of data. Presentation of data. The researchers face numerous challenges in this pandemic, so the researchers are doing our best to overcome them by collaborating with one another. No matter what challenging, no one will be able to keep us from moving forward. In light of this pandemic, as a researcher, must work very hard to complete our task so that it will remain doing something despite these pandemic's effects. The researcher introduced this type of system and demonstrate how to utilize the system to selected respondents, who are the residents of Barangay Estefania and the staff that use the system. The respondents assess the system acceptance using the adapted instrument, which is Computer System Usability Questionnaire, which was based on system usefulness and convenience of use for admin and staff. In data analysis, these sections present the analysis of data collected and gathered from the parents of Barangay Estefania. Participants of the study. The respondents of the system were taken from the parents of Barangay Estefania. The data received from the respondent is analyzed by encoding the responses using the rating scale supplied in the questionnaire and solving the main and verbal interpretation to interpret the survey result. The system evaluates using the adaptive survey instrument based on Computer System Usability Questionnaire or CSUQ. The level of skill provided indicates the following: 1 is strongly agree, 2 agree, 3 somewhat agree, 4 neither agree or disagree, 5 somewhat disagree, and 6 disagree, and lastly 7 strongly disagree. The table 6.1 showed that the usefulness of the system helped the respondents more effective and productive. In a way, they can serve more clients as well as clients may feel convenient in serving themselves an online appointment. The interpretation of data and usefulness of the system strongly was the mean of 1.1. 6.2 shows that information quality that the system help respondent can easily manage and they use the system without any helping from a companion. The information quality is the mean of 1.2, which is interpreted as strongly agree. The table showed that the respondent claimed that the interface quality of the system was an overall score of 1.23, which interpreted as strongly agree. The respondents of the system respond that the user find it as a necessity which user can enable the system efficiently and unpleasant to use. In overall satisfaction rating, the table shows that the respondents claim the overall satisfaction rating has a mean score of 0.11, which interpreted as strongly agree. The respondent of the system respond that the user was very satisfied with this system.
Chapter 5, Summary of Findings, Conclusion, and Recommendation. Summary of findings. The web-based health immunization management system will serve as a tool for parents and staff to collect data on infants, improve the registration process and immunization schedule via internet, and to increase overall value, monitor infant records and reports. The recommendation of the web-based health immunization management system enables the completely automation of the traditional manual procedure of health immunization for newborn babies in Barangay Estefania. Conclusion. The manual practice of immunization for the infants in Barangay Center reduces because the researchers make a solution about that. As a result of the COVID-19 outbreak, many babies are unable to go outdoors to get immunized, and only a limited numbers of vaccines are available. So as researchers introduce a proposal, a system called the Web-Based Immunization Management System, it can help the parents, not just the parents, but the entire staff of the said barangay. The web-based health immunization management system had been proven and accepted by the people of Barangay Estefania. Based on the result of our survey, the majority of them strongly agree. As a result, researchers created this type of system that is beneficial to parents, BHW, and the staff of a specific barangay. Recommendations. The proponents came to the conclusion that the system could accomplish the elements listed in the scope and objectives. The method gives information functionality to users efficiently. First, It is recommended to the user of a system in the registration process of the client side, which include the parent and child or children data are highly recommended. Second, it is recommended that you use the system since it has a set of user interfaces that make it simple to use. Third, it is recommended to the user to use medium interfaces such as PC, smartphones, and tablets. 4. It is recommended to the user and the admin that can create and view list of users registered so that it might be monitored as easily. Fifth, it is highly recommended to the admin side in terms of scheduling and monitoring immunization status. Sixth, it is recommended to all BHW and staff to provide immunization reports are highly recommended. And lastly, it is recommended for the future researchers to make this study as a basis of the future proponent.